Hi, I'm Cindy, and I'm a registered nurse, and I'm here to talk to you today about BiPAP, also called bilevel positive airway pressure. BiPAP transmits positive pressure through the upper airway to the alveoli in the lungs, resulting in improved lung function and better ventilation. Although originally used for patients with chronic respiratory failure and respiratory fatigue resulting from progressive neuromuscular diseases such as MS, ALS, or muscular dystrophy, its use has broadened to include the treatment of acute respiratory failure, exacerbation of asthma, pulmonary edema from CHF, as well as severe sleep apnea. It is also useful for the treatment of elevated CO2, also called hypercarbia, in patients with respiratory acidosis by helping to blow off excess CO2. BiPAP is a useful tool in the weaning of patients off mechanical ventilators. BiPAP can also be helpful for the management of patients with cystic fibrosis, COPD, and lung cancer.